Welcome to the Interprofessional Space podcast, where the spirit of inquiry meets healthcare collaboration. In our podcast, we discuss all things interprofessional education. According to the World Health Organization, interprofessional education, or IPE, is when students from at least two healthcare professions learn about, from, and with each other to improve health outcomes and enable effective collaboration.
Maximilian O'Brien is a third-year medical student at the University of Nottingham in the United Kingdom. He is currently serving as Vice President of the Centre for Interprofessional Education and Learning's Student Committee at the university. Max is deeply passionate about how interprofessional education can create more cohesive and effective healthcare systems. Beyond that, he brings a global perspective to his work, having completed a surgical internship in Mexico, and he has a strong interest in longevity and preventative medicine.
We are really excited today to be talking with Max O'Brien. Max, welcome. We've been really looking forward to having this interview with you today.
Yeah, welcome, Max. It's great to have you.
Thank you very much. It's a pleasure to be here.
So if we could just start off with you telling us just a little bit about your background and what you're doing now.
Sure. So my name is Max O'Brien. Right now, I am a third-year medical student at the University of Nottingham, and I'm also Vice President of the Student CIEL Committee, which is basically a committee for interprofessional education at Nottingham. As for my personal background,
yeah, go ahead.
Yeah, so I grew up in Hong Kong, and then I came to England for secondary school and now university as well.
Fantastic. So I just want to, you mentioned you used the phrase CIEL. Can you just tell us what those letters mean for folks who may not be familiar with that?
Of course. So it's not to do with the animal. It's actually CIEL, which stands for the Center for Interprofessional Education and Learning.
Perfect. So do you have experience at any level working in healthcare prior to your educational journey here at Nottingham?
No experience working in healthcare. I have been a patient of healthcare.
A lot of learning there.
Yeah, though bar the clinical experience and preclinical experience from medicine, I don't have much experience.
Okay, that's fantastic. That works.
What drew you into medicine? Why did you choose to apply for medicine?
Partially because I find the science behind it really interesting. Like at school, like humanities was not really my thing, so I leant more towards the sciences, and I think the biological sciences are fascinating, and how we can actually modify those using medicines is really interesting to me. As well as that, I really like having like short and sweet interactions with people. I feel like it's a really nice blend of actually talking to people and pursuing sciences.
So you've got some clinical experience at this point, is that correct?
Yeah, so right now I am just finishing my last week of psychiatry. So it's the second 6-week block. So almost 12 weeks of clinical experience.
That's great. We all start somewhere, so that's fantastic. So what other areas have you explored so far in your clinical experience?
So the first 6 weeks were, they call it junior medicine, which is basically where you're rotating 1 week in a different specialty throughout the hospital. So you do things like cardiology, respiratory, endocrinology, and a couple more.
And did you have one or two that at this point you feel most drawn to after that exposure?
I really enjoyed cardiology. I thought it provided a really nice blend of, like, the patient group you're treating are people who are like seriously ill, like having heart attacks that need like urgent treatment, and it's like a really scary point in their life, and they always want to get better. And I really like that aspect of it, because it not only is it urgent, but also they are very compliant as patients. Not that other patients aren't compliant, but I can see Susie's face there. But another thing about cardiology that I really liked was that the examinations you do, like an actual cardiovascular examination, just by listening to a person's chest, you can find out so much information if you understand how to process what you're listening to. And also things like ECG, like there are so many like layers to understanding there. Like you can recognize someone that's healthy, but then as soon as there's a disease, there's so much information available to you just from looking at a little 10-second squiggle on a screen, which I think is amazing. I
It
really
is
like the
amazing.
complexity of it.
So as a nursing student, I did not enjoy my rotations on the cardiovascular unit, but I ended up there after graduation and fell in love with that kind of nursing. It just, the way the heart works and the way it, involves cardiovascular, the whole body, it's fascinating. So I think I get a little bit about what you're saying there.
Was that by choice that you ended up there?
Yes. Mm-hmm.
Yeah, I thought it was really cool. And it's also, we were personally in like this like tertiary facility. Everything was super new, super nice, like the highest end equipment, all the fancy new toys. And I was like, wow, this is a really nice place to work.
Makes a difference, doesn't it?
And where are you right now? What hospital are you in?
So right now I'm doing psychiatry. So this week I was in the local mental health team, which is based, for reference, in Nottingham, there's a climbing gym called Depot. It's like 5 minutes from there. I don't know the area or what it's called, but that's my reference.
Okay.
I usually do food references, like it's near this restaurant.
You've been at the University of Nottingham for 3 years. So can you explain your experience with interprofessional education while you've been there?
Yeah, of course. So interprofessional education comes in, I'd say, like two parts at the University of Nottingham, at least. So there's one part that's integrated into your course. So each year you'll have at least one activity where you do it interprofessionally. So in my first year, we had this really good public health exercise, which was a really great opportunity to meet other healthcare students. So I met a lot of pharmacists, physios, public health students, and as well as the integrated part of interprofessional education, there's the sort of, I just want to say, voluntary part. So as part of the committee, we organize a bunch of different events, which gives people an opportunity to come and meet in a more informal manner. So you can get to know more people and just sort of network a bit with different healthcare students.
Excellent. And what role do you play on the student committee?
Oh, it's a good thing you ask. I'm actually vice president of the committee this year. In previous years, last year I was the newsletter editor, and the year before that I was the vice newsletter editor. So I've slowly worked my way up.
World domination next, right?
Exactly.
Yeah.
It's on the list.
All right. So you're in a really important part of your education where you're taking what you've learned in the classroom and you're starting to apply some of that in the clinical environment. Can you talk a little bit about how you've pulled from your IPE experiences in the clinical environment?
Absolutely. So the main experience that I'm going to reference is an event called MidMed, which is like an optional event that they ran last year. I'm not sure if it's run this year yet or if it's running next year. I think it's running next year.
Zakia, who's our midwife who leads on it, is on maternity leave for next year, so it won't be running. But we're taking a little pause and then it will be back the following year. But yeah.
Okay. Well, anyway, so MidMed ran last year and it was a really great event. So it combined, I think it was open to all or most healthcare professions. Correct me if I'm wrong, Susie.
It was midwifery medicine students.
Oh, it was only us two?
Yeah.
Oh, I didn't remember.
Yeah, specifically because of the reports that had come out around the problems around maternity care and specifically around the communication with midwives and medics.
Okay. Well, yeah. So it only runs and it's for medicine and midwifery students. And basically, it was a day where you had the option to go through some simulated, I want to say, obstetric emergencies, um, which was a really interesting experience because when I did it, I was in my second year, and so were the midwives. But at that point in their journey, they were halfway through their course. They had delivered a bunch of babies themselves, not themselves, but they have a lot more hands-on experience than a medical student did at that point. So it was a really great opportunity to actually understand more about the different roles that we have in healthcare. Because throughout the medicine course, you're taught about medicine. You're not taught about how the healthcare system works as a team. Sure, they glance over it, they tell you a little bit about who you refer to and who you don't. But through experiences like the interprofessional education, you actually get a taste of how you work together as a team, the different sort of specialties, not specialties, but obviously a midwife is their skill set is delivering babies. A doctor's isn't at that point. So it was really nice to actually understand that they have like a different skill set in healthcare, and it's okay to sort of use their skill set when it's needed, right?
So looking at their like roles and responsibilities
Exactly, yeah.
in the team. Yeah.
Sorry, what was the question? I feel like I kind of got quite convoluted there.
No, you did great. I have a follow-up question. Did anything surprise you about that? It sounds like one of your big takeaways was knowing that you could rely on them as professionals, the midwives. Is there anything that surprised you about their role or about the way you interacted with them?
Um, hmm. So what did surprise me from mid-med was that from my pretty naive point of view as a medical student, my understanding was the doctor would always lead. But from mid-med, um, I guess I was a little surprised at how uninvolved as a doctor I would be in like a normal birth. Like the midwife is fully equipped and skilled to do the job of a normal birth by herself. Like I was not needed there. They can handle all of that. And I was just really impressed how like, you know what, doctors aren't always the center of every part of healthcare.
How did you feel about IPE before you experienced? You've talked about your experience with MidMed and what you learned from that, but prior to that, what did you think about interprofessional education or interprofessional working, collaborative practice?
So before actually going into the clinical phase and seeing how the interprofessional education actually impacts patient care, um, I think I was quite naive in thinking that the fact it was integrated into the course was sort of like a tick box exercise. I felt like it was just ensuring that we're able to collaborate, you know? I felt just get them in a room together, let them talk, make sure they know who they're working with in the future, and that was interprofessional education. But after having been in clinical environments where you actually see how each role has its own input into patient care, and it's the combination of all those inputs which create an effective healthcare system.
That was brilliant. Well
Thank you.
said.
I did right.
Yeah. So follow-up question on that. Do you have an experience that you can share from the clinical environment where you saw interprofessional collaboration work particularly well? Totally putting you up the spot here.
So most recently, during my psychiatry placement, I was in it's called Highbury Hospital. It's just a psychiatric hospital. And I was sat during one of the team meetings where we were preparing to discharge a patient. And at that point, so around the table, there were social workers, nurses, psychiatric nurses as well, like community ones on the team's meeting, and the doctor. And it was really interesting for me to actually see that each person contributed a different part about the patient. There was also a pharmacist there, actually. So the pharmacist was clarifying that all the medications following the discharge were ready and were correct in their dosage and prescription. The community psychiatric nurse was ensuring that the patient was ready to actually have their first meeting once they were discharged. The doctor made sure that their mental state was okay and that they could actually be discharged. And the nurse was there for support. She was saying that the patient feels ready and that they are actually prepared to go out back into the world. I want to say the real world, but leaving the hospital.
Mhm.
So I think that was like a very real experience of seeing a bunch of different healthcare professions actually contributing to just one single patient, because there were so many different perspectives and all of them looking at slightly different things, slightly different aspects of the patient's care. And by bringing all of those together, they made an effective discharge plan, which left the patient feeling more at ease. And personally, left me feeling more at ease as well, knowing that the patient's going out there with all this plan in place to make sure that they are actually ready to go back out.
Was the patient involved in the discharge meeting?
So the patient was there at the discharge meeting. Um, they were organizing social care as well whilst I was there. So they were accommodation when they were leaving, and he did ask his questions and made his preferences known.
Wow.
So it was really good to see.
That's nice. That's a great way of involving the patient. We just talk about that patient-centered care and the patient's
Yeah,
part of the team. But gosh, it's good.
yeah,
And I really appreciate you sharing that example
Yeah.
because it's real life, which I think is important. But as a facilitator of IPE, sometimes I think I have to create these opportunities where these huge events happen or these huge, like really exciting things occur to get students to get something positive from it. And what I'm hearing from you is this everyday event, which is a discharge planning meeting, done well is incredibly powerful in terms of the patient outcome, which is obviously the most important thing, but also the collaboration across team members. So that's a great example. Thank you. Here's a question. This question's about challenges. So you gave us a great example of things going well. Have you experienced challenges in working interprofessionally in a clinical setting, or even in the CIEL, the work that you do on the committee or in the classroom setting? Have you faced any challenges in that regard?
So beginning the placement, um, we have these things called DOPS, which are like procedural skills that we have to check off, right? So throughout junior medicine, you're tasked with doing things like taking bloods, cannulas, IV infusions, and things like that. So what I noticed on the wards is, for starters, we were allocated just to a ward. There was no like doctor or anyone to make sure we got these things done. We were told, go to this ward and use your time how you will. So naturally, you want to tick off these tasks, but a lot of these tasks aren't actually done by doctors on a day-to-day basis. Like the doctors aren't the ones that take the blood or put in the cannulas or give the medications. So as a medical student on these wards, my intention was obviously to try and take off as many of these tasks I could do. But I also realized that these aren't my tasks. Like as a doctor, I'm not looking for a doctor here. I'm sort of encroaching on what the nurse's job is. And I noticed that a lot of the nurses, as you walk around in your scrubs that say in big letters medical student, they sort of just look at you and ignore you, thinking like, oh, okay, he's here looking for the doctor. He's just going to ignore me and keep doing his thing. So I found that the nursing staff, especially, were a little cold to begin with to the medical students. I feel like you had to really go out and introduce yourself, say who you are, say that, listen, I need to try and do these things. If I can help you and take some of these off your hands, I'd be really appreciative. And yeah, I think actually sort of getting them on board with allowing you to help as well, I thought that was a little difficult to begin with.
And it sounds like one approach to managing that was for you to just connect with them and be honest with them and ask them. And it sounds like you offered to help as well, which is nice.
Yeah, I thought a big part was just sort of showing them that, you know what, like you respect what they do and that they're the experts in this area and that you want to learn from them as well. I think demonstrating that is really important because obviously like the doctor sometimes often leads a team, and as a medical student I feel like the reputation is that you're a bit up your own and that you have like a big head because you're like, oh wow, okay, look at me. But like actually putting your ego to the side and being like, listen, you're the expert. You know how to set up an IV infusion much better than I do. Like I'm here to learn from you. I'd be really grateful if you could just teach me. I think putting your ego aside and doing that is really important to actually establishing that first contact and relationship with the staff there.
What made you decide to take that approach?
To be honest, I did walk around the ward for a good half an hour before I decided, you know what, this isn't going to happen magically. I need to, I can see that nurses do this. I need to talk to them and ask for their help with this.
I don't think a half an hour is that long, so good for you. Well done. So, and I think some students and some healthcare professionals spend an awful lot of time when they could just approach each other. And it's not just a med student sort of thing. I think it happens across professions. So yeah, hats off to you.
I think in other areas, so whether it's been in practice or in other IPE that you've done, have you found any difficulties in communicating across different disciplines, and how have you remedied that besides what you did in practice with the nurses?
So honestly, for this question in particular, I haven't found that many difficulties with communicating to other healthcare professions. I feel like we're all on a pretty similar sort of level of understanding. Like, we know we're all there for the patient's sake, and if you communicate that clearly enough, I think everyone wants to do what's best for the patient, right? I personally haven't really had any difficulties. If I were to speak about one thing, it would just be like avoid using overly complex language. I know a lot of medical students, like when we go out on the wards together, they just spit out all this medical terminology, which a lot of people don't understand. Like even if you are a healthcare profession, it's just unnecessarily complicated. So I personally have found when I'm talking to other healthcare professions, I don't want to assume that they have all this fancy medical terminology, that it may as well just avoid any misunderstanding and speak naturally. But to be honest, personally, again, I've not really had any difficulties in communication, thankfully.
I've always been impressed. No. I've learned over time. So our institution has primarily nursing and x-ray tech. And nursing will use acronyms, abbreviations, whatever. And x-ray techs will use them as well, radiologic technologists, but they don't mean the same thing at all. So you could be using the same letters in the same order and mean completely different things. So I think that's a really good point that you make about making sure, reducing the risk for miscommunication, right? By just not using the terminology or the acronyms and just sort of speaking a little more plainly.
Yeah, I just think it makes everyone's life a bit easier, to be honest with you.
Yeah.
Because it's also like presuming other people's knowledge, and I don't think that's a good first step.
I agree. And I also think, healthcare is inherently stressful. I mean, it should be to some degree, because as you said, we're taking care of people and that's the most important thing. And anytime you increase the level of stress, the things that can be harder to sort of access in that moment. So anything we can do to reduce the risk, the opportunity for miscommunication is really important. Max, we'd like to talk a little bit about professional identity. And the question I have for you is, in what ways did IPE help you develop your own professional identity and your understanding of your role on the team?
That is a great question, Anna. So I think interprofessional education has helped me establish my own personal identity through understanding the roles of other professions as well. So obviously healthcare is a very wide term and there's a lot of overlap in the roles. But I feel by being exposed to different healthcare professions and learning more and understanding more about their roles, that sort of establishes a bit more of how you fit in between these roles, if that makes sense.
Mm-hmm.
So I found by understanding, say, what the pharmacist can do, I know that, okay, I need to bring it to this level and they can sort out the rest. Same with physios, understanding that, okay, I need to sort of understand that it's a musculoskeletal problem. The physio is able to diagnose exactly what it is. So I think by understanding a bit more about the realms of what each profession can and can't do, it sort of makes it clearer what your role is between connecting those professions.
How has working in an interprofessional team, so whether it's been in school or in practice, impacted your confidence in your professional abilities?
So I think by working in a multidisciplinary interprofessional team, and learning more about the different roles in healthcare, this is a point I come back to a lot, but by understanding that we all have different skill sets and the strengths that other professions have, it's a lot easier to know that you can rely on other people's strengths, and that kind of reduces the amount of things that you need to do yourself. So it's not outsourcing, right? But like other people are good at things as well. So you don't have to do everything yourself. Rely on other people's strengths, use them as part of your team. That's what a team is there for. And by sort of realizing that you don't have to do it all, I think that has really improved my confidence in what I do.
And would you say IPE has changed the way you view leadership and decision making on the healthcare team?
Oh yeah, definitely. I think before my view was that the doctor was sort of the leader of the team, but actually having experienced it now, I recognize that whilst you may lead the team, like it's not your decision. Everyone has a part to play in the decision making. And I think that's really important and really valuable to recognize. So I would very much distinguish leadership as in, like, for example, running a meeting, to decision making where everyone is involved and everyone's opinion and perspective is valued.
That's a great distinction.
And can I ask a question then? So, I mean, when you came on board and you started the IPE session, or the IPE stuff, you didn't seem to really believe in it so much. But why then did you join the committee in your first year of medicine? What drew you to the committee?
To be honest, it was sort of an opportunity to meet more people in the healthcare space. I feel like healthcare degrees sort of attract a certain type of person, and I get on with that kind of people. So I figured by joining the committee, it would be a great opportunity to actually meet like-minded individuals. It's kind of for like social reasons.
So curiosity first, right? And then you sort of realized it's more of the benefits, or realized that IPE had something additional to offer you, which is great. So let's take that a little bit further. What advice would you give to current students or students just coming to IPE in terms of making the most out of their experiences?
I would say what you put in is what you get out. I think that it's like very age-old advice, but it's really important when you come to these sessions to actually have an open mind and like discuss things with your peers. It's very easy to sit there in silence and just spend an hour and a half until the exercise is done. But by actually interacting, like questioning your peers, why do they think that way? Why is that their answer? You can actually learn a lot more. And you may not realize it as a student, but once you start getting into clinical phases, like understanding a bit more about others and their roles is really, really important.
So I've got a question for you, which is that's a I feel it's a bit loaded question because I'm the one that runs the IPE sessions here at Nottingham, but I'm not going to take it personally. So it's free. You can say whatever you want to say. But looking back on the last 3 years of your time here, so is there anything that you wish you'd learned more about during your IPE sessions that would have helped you now when you're in practice?
So I'm not so sure this is just in IPE sessions alone, but I think having a more holistic approach to the system, like understanding a bit more about what each role does, would be really helpful. Because I know in my course at least, they just teach you one thing, and that's medicine. They don't teach you about the system as a whole and how it fits together. And I think exercises which sort of focus on that are really, really valuable, which is like why I thought mid-med was brilliant.
All right. So taking that a little bit further, do you have any recommendations for faculty or facilitators of IPE? What do you need us to know?
Um, so make people interact. It's it's awkward, right? You've got a
Mm.
bunch of strangers in a room together. They don't know each other, they're not friends, and they have to do an activity together. I think make them interact, do icebreakers, start with something easy, fun, make everyone go around in a circle, say their name, favorite movie. Like break the ice. It's so much easier once you've broken the ice for people to start talking
Okay.
than to just leave them there and let them do it. Because more often than not, people at school are pretty easily not going to do anything. They'll just sit there for an hour and a half until it's done. I think by making them interact and they get much more out of it, and I think you'd get much more out of it as well.
That's helpful. Thank you.
So last year, so you did a presentation with Vic, who's now the president of the student committee, at the INWE conference, it's the International Network for Health Care Workforce Education. And it's an IPE conference that was in Barcelona. The title was Evaluating the Educational and Networking Opportunities for the CIEL Student Committee at the University of Nottingham. So can you talk a little bit about that experience and what that was like? Yeah.
So that experience was really valuable because it was a chance to sort of get into research. Um, it was like a taster, right? You're not doing an entire research project and writing a dissertation. It's more just understanding a bit more about the process of how you research, and also you get to choose what you're researching within the lines of inspirational education. So I thought it was a really great opportunity actually, just sort of like dip your toe in the pool and see what research is like, to run a little project. And
What was it
sorry,
like
what
to
was it?
present?
Oh,
So
to
you're at
present.
a conference. Yeah, so you did the research bit and then we did that as kind of a supported thing. And then but then you went and presented it too at the conference, didn't you? And there I think you and Vic and there were you guys were like pretty much the only undergrad students that were there. So how did that feel? What was that like? I mean,
Um, Honestly, a little nervous. I mean, you're sat in a room with people who are like professionals in interprofessional education, and you're presenting like a little bit of research that you've done, which is vaguely relevant. So to be honest, it was a little intimidating going up there and speaking in front of all the professionals, but it was still, I think it was a really valuable experience, and I'm really grateful for the opportunity to actually do that, because it was sort of a really good taste of sort of networking and a conference. And plus, the interprofessional education is like a really fun crowd. So all in all, it was a really valuable and good experience. I would recommend it to other people.
I think what we like about that conference specifically is it is very small. It's more of like an intimate setting, so you actually really get to talk to everybody. There's not like hundreds of people around. It's like you're around really like-minded people that you can kind of chat with anybody and take up a conversation. So, yeah.
So I'm glad that you talked about that presentation. I, as an IPE leader at my institution, would love to see my students be more engaged, like you are or you were. What sort of words of wisdom or suggestions do you have for me and for other IPE facilitators to encourage their students to engage with presentations like the one you did?
So my recommendation would be making people aware of the opportunity is really important. Like, had Susie not advertised and reminded us a couple of times that, hey, listen, there's this conference going on, let's do this, I don't think I would have done it. So I think being aware of the opportunity and making people aware of that is really important. But also, Susie was kind enough to actually like walk us through the process of doing the research and sort of holding our hand through that, like teaching us what we have to do. And without that, I had no research experience, so I don't think I would have partaken. But actually having that like holding hand and structure throughout the process also really helped me get involved personally, because it sort of opens the door to people without that experience.
All right, so the last set of questions that we do for this podcast are inspired by the pivot questions used on a show called Inside the Actors Studio. Have you seen it? It's okay if you haven't.
No,
Okay.
I don't really
Well,
do TV.
that's all right. It's just so we kind of honor where we found the idea for these questions. You're free to skip any of them. There's no wrong answer. But I think we both think that they're kind of interesting to hear what people have to say in answer to these. So my first question is, what is one thing about your own healthcare profession that you wish other team members knew?
Maybe that doctors don't actually know it all. Like, there's a lot that we do not know, and a lot of people look to us for answers.
Mm-hmm.
But there's a lot of times when we don't know what we're talking about.
That must be really stressful to feel like everyone's looking to you to have all the answers, I would think.
As a medical student, it's fine because I'm a medical student. People don't look up to me yet. But as a doctor, maybe it comes with experience and you know what you're talking about. But from my perspective, there's so much to learn.
Yeah. So, do you have a favorite medical word?
Yes.
Okay, what is it?
It's idiopathic, which is
And
like a fancy medical term, which basically means that we don't know what causes it. I think it's just really interesting that there is a medical term for something like that. And if you don't know what it means, it's like, oh wow, okay, it's a diagnosis. But if you understand what it means, it's like, oh, they don't know what this is. And I think that's really fun.
Okay. What is a profession other than medicine that you would like to attempt?
Probably teaching. I think teaching is really cool because it really requires you to understand what you teach and be able to convey that information in a simple way, which I think is a really valuable skill. And that's something that I would like to try.
so, what is a profession other than your own that you would not like to do?
pretty much any office job. I feel like sitting in front of a screen all day and just pressing buttons on a keyboard, I think that would drive me nuts.
What is a sound or a noise that you love?
Boing. You familiar with this sound? This is one of my favorite sounds. I just think it's like a fun, playful sound. Boing.
Wait, so is it saying the word? Or is it something making that noise, like a coil or something?
So I was trying to think of what made the sound boing, but I couldn't think of any. So I just went with the word. But
Okay.
if something makes that sound, I'm sure I'd be a fan of it as well.
Okay, all right.
So what is one career you imagined doing when you were a child?
As a kid, I really wanted to be a vet. But then I realized you can't talk to animals unless you're Dr. Dolittle. So I was like, that doesn't sound as fun.
What is a book that you're currently reading or that you would recommend?
So I'm currently reading a book called The Body Keeps the Score by Bessel van der Kolk. I don't know if you've read it. You have? No?
No, I've heard of it though.
Susie has.
Yeah, it's good. Yeah.
Yeah, it's good. It's about like trauma and processing. Just processing things. I thought it was a really good read.
Right, thank you for that. And that's the end of our questions. So I want to thank you, Max, for taking the time to talk with us. It's been a joy. And I want to wish you all the good things as you continue your education.
Thank you very much. I appreciate your time.
Thank you, Max, for talking to us today. Really appreciate it. It was great.
Thank you very much for having me. It's been a pleasure.
So before we sign off, we want to remind you, whether you're a student, a practitioner, or an educator, the work that you do is important and can be very stressful, but you are not alone. Please take care of yourself. Let's look out for each other, and we hope you will join us again soon. Thank you for tuning in to the ISPACe podcast. If you enjoyed today's episode, please take a moment to like, subscribe, and share it with your friends. Your support helps us bring you more great content. Stay tuned for our next episode.